Chapter 5, Inflammation and Healing. Copyright 2023, Elsevier Inc., all rights reserved. 1. Body defenses, 1 of 2. First line of defense, non-specific mechanical barrier, unbroken skin and mucous membranes, secretions such as tears and gastric juices. Second line of defense, non-specific phagocytosis inflammation. Copyright 2023, Elsevier Inc., all rights reserved. 2. Body defenses, 2 of 2. Third line of defense, specific defense production of specific antibodies or cell-mediated immunity. Copyright 2023, Elsevier Inc., all rights reserved. 3. Defense mechanisms in the body. Non-specific defenses, fluids, tears, saliva, mucus, gastric acid, barriers, skin, and mucous membrane, specific defenses. All defenses overcome pathogens or injurious agents, phagocytosis, inflammatory response interferon, immune response, cell-mediated and humoral. Copyright 2014, 2011, 2008, 2002, 1997 by Saunders, an imprint of Elsevier Inc. Injury or disease. 4. Copyright 2023, Elsevier Inc., all rights reserved. Normal capillary exchange. Generally, not all capillaries in a particular capillary bed are open. Depend on the metabolic needs of the cells or need of removal of wastes. Movement of fluid, electrolytes, oxygen, and nutrients on arterial end based on net hydrostatic pressure. Send venous end. Osmotic pressure will facilitate movement of fluid, carbon dioxide, and other wastes. Copyright 2023, Elsevier Inc., all rights reserved. 5. Normal capillary exchange versus inflammatory response. Normal, arterial precapillary sphincter venule. Open capillary, closed capillary. 1. Blood flow. 2. Normal fluid shift protein remains in blood. Water, electrolytes, glucose into interstitial fluid. 3. Cells remain in blood. Blood cell bradykinin A, albumin, globulin, histamine. Inflammation. 1. Injury. 2. Cells release chemical mediators. 3. Vasodilation, increased blood flow. 4. Increased capillary permeability, protein and water leave. Capillary form exudate water. 5. Leukocytes move to site of injury. Water, electrolytes, and protein. Leukocyte, chemotaxis G. 6. Phagocytosis, removal of debris in preparation for healing. Fibrinogen PG, prostaglandin, macrophage engulfs debris. Copyright 2014, 2011, 2006, 2002, 1997 by Saunders, an imprint of Elsevier Inc., Phagocytosis. Copyright 2023, Elsevier Inc., all rights reserved. 6. Physiology of inflammation, a protective mechanism and important basic concept in pathophysiology. Disorders are named using the ending itis. Inflammation is a normal defense mechanism. Signs and symptoms serve as warning for a problem. Problem may be hidden within the body. It is not the same as infection. Infection, however, is one cause of inflammation. Copyright 2023, Elsevier Inc., all rights reserved. 7. Causes of inflammation. Indirect physical damage examples. Cut, sprain, encaustic chemicals. Examples: acid, drain cleaner, ischemia or infarction, allergic reactions, extremes of heat or cold. And foreign bodies examples: splinter, glass, an infection. Copyright 2023, Elsevier Inc., all rights reserved. 008. Steps of inflammation. When release of bradykinin from injured cells. Inactivation of pain receptors by bradykinin. And mast cells and basophils release histamine. And capillary dilation. Bradykinin and histamine increase blood flow and capillary permeability. Bacteria may enter the tissue. A neutrophil and monocytes come to injury site. The neutrophils phagocytize bacteria, and macrophages leave bloodstream for phagocytosis of microbes. Copyright 2023, Elsevier Inc., all rights reserved. 9. Acute inflammation. A process of inflammation is the same regardless of cause. Timing varies with specific cause. Chemical mediators affect blood vessels and nerves in the damaged area. Vasodilation, hyperemia, increase in capillary permeability, chemotaxis to attract cells of the immune system. Copyright 2023, Elsevier Inc., all rights reserved. 10. Chemical mediators in the inflammatory response. Table 5:1 chemical mediators in the inflammatory response: chemical histamine. Chemotactic factors: platelet activating factor, PAF, cytokines, interleukins, lymphokines, leukotrienes, prostaglandins, PGS, kinins, for example, bradykinin, complement system. Source: mast cell granules, cell membranes of platelets, T lymphocytes, macrophages, synthesis from arachidonic acid in mast cells, activation of plasma protein kininogen, activation of plasma protein cascade, major action: immediate vasodilation and increased capillary permeability to form exudate, for example. Attract neutrophils to site, activate neutrophils, platelet aggregation, increase plasma proteins, ESR, induce fever, chemotaxis, leukocytosis, later response, vasodilation and increased capillary permeability, chemotaxis, vasodilation, increased capillary permeability, pain, fever, potentiate histamine effect, vasodilation, and increased capillary permeability, pain, chemotaxis, vasodilation, and increased capillary permeability, chemotaxis, increased histamine release. Copyright 2014, 2011, 2006, 2002, 1997 by Saunders, an imprint of Elsevier Inc. Copyright 2023, Elsevier Inc., all rights reserved. 11. Local effects of inflammation, redness and warmth, caused by increased blood flow to damaged area, then swelling, edema, shift of protein and fluid into the interstitial space, and pain, increased pressure of fluid on nerves, release of chemical mediators, for example, bradykinins, loss of function, may develop if cells lack nutrients, edema may interfere with movement. Copyright 2023, Elsevier Inc., all rights reserved. 12. Erysipelas. From Mahan C.R., Lehman D.C., Manusela G., Textbook of Diagnostic Microbiology, ed. 3, St. Louis 2007. Saunders, copyright 2023, Elsevier Inc., all rights reserved. 13. Exudate. Serous, watery, consists primarily of fluid, some proteins, and white blood cells, fibrinous, thick, sticky, high cell and fibrin content, purulent, thick, yellow-green, contains more leukocytes, cell debris, and microorganisms, abscess, localized pocket of purulent exudate in solid tissue, hemorrhagic exudate present when blood vessels are damaged. Copyright 2023, Elsevier Inc., all rights reserved. 14. Systemic effects of inflammation, mild fever, pyrexia, common if inflammation is extensive, release of pyrogens, malaise, feeling unwell, fatigue, headache, anorexia. Copyright 2023, Elsevier Inc., all rights reserved. 15. The course of fever, body temperature, normal. 2. Reset, hypothalamic control, high. 4. Body reaches new high temperature, feel warm. 5. Treatment 2. Remove pyrogens. 6. Reset hypothalamus to normal. 1. Release of pyrogens in circulation. 3. Body responses that increase body temperature. Shiver, chills, vasoconstriction. In skin, pallor, increased BMR, increased heart rate, curl up body, time, temperature control in hypothalamus, body temperature. Copyright 2014, 2011, 2000, 2002, 1997 by Saunders, an imprint of VIE. 7. Body responses that increase heat loss, and vasodilation sweating lethargy. Extend body. 8. Body returns to normal temperature. Copyright 2023 Elsevier Inc. All rights reserved. 16. Changes in the blood with inflammation. Table 5 to 3 changes in the blood with inflammation leukocytosis. Differential count. Plasma protein C reactive protein. Increased ESR. Cell enzymes. Increased numbers of white blood cells, especially neutrophils proportion of each type of white blood cell altered, depending on the cause, increased fibrinogen and prothrombin, a protein not normally in the blood, but appears with acute inflammation and necrosis within 24 to 48 hours. Elevated plasma proteins increase the rate at which red blood cells settle in a sample released from necrotic cells and enter tissue fluids and blood, may indicate the site of inflammation. Copyright 2014, 2011, 2006, 2002, 1997 by Saunders, an imprint of Elsevier Inc. Copyright 2023, Elsevier Inc. All rights reserved. 17. Course of inflammation and healing. Tissue injury. Acute inflammation. Release of chemical mediators, histamine, kinases, prostaglandins, vasodilation and increased blood flow, hot red, increased capillary permeability, edema, pain, chemotaxis, WBC to area, irritation of nerve endings, pain, clot and fibrin mesh, walls off area, phagocytosis, remove cause and cell debris, preparation for healing, if cause persists, chronic inflammation, healing, scar tissue, fibrosis, regeneration, replacement by same type of cell. Copyright 2014, 2011, 2006, 2002, 1997 by Saunders. An imprint of Elsevier Inc. Resolution, damaged cells, recover. Copyright 2023 Elsevier Inc. All rights reserved. 18. Diagnostic tests when leukocytosis increased with blood cells in blood, and an erythrocyte sedimentation rate elevated. Differential count helpful to distinguish between bacterial and viral infection. And circulating plasma proteins and cell enzymes. Isoenzymes may be elevated. A necrosis. Copyright 2023, Elsevier Inc. All rights reserved. 19. Potential complications. Infection. Microorganisms can more easily penetrate edematous tissues. Some microbes resist phagocytosis. The inflammatory exudate also provides an excellent medium for microorganisms, and skeletal muscle spasm may be initiated by inflammation protective response to pain. 20. Copyright 2023, Elsevier Inc. All rights reserved. Chronic inflammation follows acute episode of inflammation, when less swelling and exudate, when presence of more lymphocytes, macrophages and fibroblasts, continued tissue destruction, and more fibrous scar tissue, and granuloma may develop around foreign object. 21. Copyright 2023, Elsevier Inc. All rights reserved. Potential complications. MEP ulcers may result from severe or prolonged inflammation caused by cell necrosis and lack of cell regeneration that causes erosion of the tissue, can lead to complications such as perforation of viscera. Extensive scar tissue formation. 22. Copyright 2023, Elsevier Inc. All rights reserved. Treatment of inflammation. When acetyl salicylic acid, ASA, aspirin, when acetaminophen, Tylenol, nonsteroidal anti-inflammatory, drugs, NSAIDs, ibuprofen, glucocorticoids, corticosteroids. Copyright 2023, Elsevier Inc. All rights reserved. 23. Drugs used to treat inflammation. Table 5 to 4 comparison of drugs used to treat inflammation actions. ASA, acetaminophen, NSAID, glucocorticoid, COX-2, anti-inflammatory, yes, no, yes, 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 analgesia, yes, 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 no, yes. Antipyretic, yes, 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 no, no. Adverse effects, allergy, yes, no, yes, no, yes, no, yes. Delays blood clotting, yes, no, no risk of infection, no, yes. No GL distress, yes, no, yes. May occur stomach ulceration, yes, no, yes. May occur EDA or increased BP, no, yes. May occur ME or CVA, no. May occur liver damage, no. May occur TET, note, allergic reactions may occur with administration of any drug. Copyright 2014, 2011, 2006, 2002, 1997 by Saunders, an imprint of Elsevier Inc. Copyright 2023, Elsevier Inc. All rights reserved. 24. Anti-inflammatory effects of glucocorticoids, decreased capillary permeability, enhanced effectiveness of epinephrine and norepinephrine, reduced number of leukocytes and mast cells, and reduces immune response. 25. Copyright 2023, Elsevier Inc., all rights reserved. Adverse effects of glucocorticoids, an atrophy of lymphoid tissue, reduced hemopoiesis, increased risk of infection. And catabolic effects, increased tissue breakdown, decreased protein synthesis, delayed healing, and delayed growth in children, and retention of sodium and water. Increased gluconeogenesis. Copyright 2023, Elsevier Inc., all rights reserved. 26. Anti-inflammatory herbs and spices. Some herbs and spices contain the same active ingredients found in anti-inflammatory medications, and turmeric, black pepper, and ginger root, rosemary. Others, cloves, cayenne pepper, cinnamon, sage, coriander, and many more. Copyright 2023, Elsevier Inc., all rights reserved. 2727. Rice therapy for injuries, rest and ice, compression, elevation. 28. Copyright 2023, Oliveira-Peace, elevation of inflamed limb, mild to moderate exercise and physiotherapy, occupational therapy, rest, when adequate nutrition and hydration. 29. Copyright 2023, Elsevier Inc., all rights reserved. Then resolution. Types of healing, minimal tissue damage, and regeneration, damaged tissue replaced with cells that are functional, and replacement, functional tissue replaced by scar tissue, loss of function. Copyright 2023, Elsevier Inc., all rights reserved. 30. The healing process, 1 of 2. Healing of incised wound by first intention. 1. Injury and inflammation. Scab suture holds edges together. Blood clot. Neutrophils, inflammation. 2. Granulation tissue and epithelial growth. Epithelial regeneration. Inflammation. Macrophage. Fibroblast, granulation tissue. Begins to form new capillaries. 3. Small scar remains. Scar, fibrous tissue. Copyright 2014, 2011, 2006, 2002, 1997 by Saunders, an imprint of Elsevier Inc. Copyright 2023, Elsevier Inc., all rights reserved. 31. The healing process, 2 of 2. Healing by second intention. 1. Injury and inflammation. Scab, blood clot, inflammation. 2. Granulation tissue and epithelial growth. Epithelial regeneration. Inflammation, macrophage. Granulation tissue and collagen. New capillary. 3. Large scar remains. Fibrous tissue contracts. Scar. Copyright 2014, 2011, 2006, 2002, 1997 by Saunders. An imprint of Elsevier Inc. 32. Copyright 2023, Elsevier Inc., all rights reserved. Scar formation, 1 of 2. In loss of function, result of loss of normal cells and specialized structures, and hair follicles, nerves, and receptors, when contractures and obstructions. Scar tissue is non-elastic, can restrict range of movement. 1. Adhesions. Bands of scar tissue joining 2 surfaces that are normally separated. Copyright 2023, Elsevier Inc., all rights reserved. 33. Scar formation, 2 of 2. Hypertrophic scar tissue overgrowth of fibrous tissue leads to hard ridges of scar tissue or keloid formation. In ulceration, blood supply may be impaired around scar. Results in further tissue breakdown and ulceration at future time. Copyright 2023 Elsevier Inc. All rights reserved. 34. Complications of scar tissue. 1 of 2, from Callan J. Greer K., Hood A., and others color Essays of Dermatology. Philadelphia, W. B. Saunders, 1993. Copyright 2023 Elsevier Inc. All rights reserved. 35. Complications of scar tissue 2 of 2, from Callan J. Greer K. Hood A., and others color Atlas of Dermatology Philadelphia, W. B. Saunders, 1993. Copyright 2023 Elsevier Inc. All rights reserved. 36. Burns. Burns, thermal, caused by flames or hot fluids. And chemical, radiation, electricity, light, and friction. Copyright 2023 Elsevier. Classification of burns. Superficial partial thickness first-degree burns involve epidermis and part of dermis little, if any, blister formation. Deep partial thickness, second-degree, burns epidermis and part of dermis blister formation. In full thickness third and fourth degree, burns destruction of all skin layers and often underlying tissues. Copyright 2023 Elsevier Inc. All rights reserved. 38. Classification of burn injury by depth. Redness blister. Superficial burn, partial thickness burn, full thickness burn. From Fraser M., Jimkowski J., Essentials of Human Disease and Conditions, ed. 6, St. Louis 2016, Elsevier. Copyright 2023 Elsevier Inc. All rights reserved. 39. Partial thickness burn. Courtesy of Judy Knighton, Clinical Nurse Specialist, Ross Tilley Burn Center, Sunnybrook and Women's College Health Center, Toronto, Ontario, Canada. Copyright 2023 Elsevier Inc. All rights reserved. 40. Deep partial thickness burn. Courtesy of Judy Knighton, Clinical Nurse Specialist, Ross Tilley Bum Center, Sunnybrook and Women's College Health Center, Toronto, Ontario, Canada. Copyright 2023 Elsevier Inc. All rights reserved. 41. Full thickness burn. EP, courtesy of Judy Knighton, Clinical Nurse Specialist, Ross Tilley Burn Center, Sunnybrook and Women's College Health Center, Toronto, Ontario, Canada. Copyright 2023 Elsevier Inc. All rights reserved. 42. Effects of burn injury, both local and systemic. Undehydration and edema. In shock respiratory problems and pain. Infection. Hypermetabolism during healing period after burn. Copyright 2023 Elsevier Inc. All rights reserved. 43. Assessment of burn area using the Rule of Nines, body surface area, BSA, 4.5% total head, 9%, 4.5%. Two arms, 18%, 9%, 4.5% trunk, 36%, 18%, 9%. 4.5%, 1% perineum 1%, 4.5%, 9% two legs 36% 9%, 4.5%, total 100%, minus 9%. Anterior body surface, posterior body surface, copyright 2014, 2011, 2006, 2002, 1907 by Saunders, an imprint of Elsevier Inc. Copyright 2023, Elsevier Inc., all rights reserved. 44. Courtesy of Judy Knighton, Clinical Nurse Specialist, Ross Tilley Burn Center, Sunnybrook and Women's College Health Center, Toronto, Ontario, Canada. Copyright 2023, Elsevier Inc., all rights reserved. 45. Healing of burns. Hypermetabolism occurs during healing period. Immediate covering of a clean wound is needed to prevent infection. When healing is a prolonged process, one as scar tissue develops, even with skin grafting, and physiotherapy and occupational therapy may be necessary, and surgery may be necessary to release restrictive scar tissue. "46. Copyright 2023, Elsevier Inc., all rights reserved. Children and burns. Growth of children often affected during the acute phase of burn recovery. Metabolic needs are compromised. An increase in inflammatory mediators may cause renal problems. Additional surgery or grafts may be required to accommodate growth and ease effects of scarring. 47%. Copyright 2023, Elsevier Inc., all rights reserved.